There is a Barnes and Noble bookstore on the campus of the College of Staten Island in the Willowbrook neighborhood of Staten Island, New York. Most students who walk through its doors do not ask why the building looks the way it does. The institutional concrete, the wide, low ceilings, the corridors built wider than a college bookstore needs. The building was not constructed to sell textbooks. It was built in 1942. It was called Building 6. In January 1972, a television camera was carried through this building using a stolen key, and what that camera recorded was broadcast on WABC-TV to the entire city of New York. The only sound the camera picked up, according to the reporter who held it, was a single continuous noise. He described it as something of an eerie communal wail. That reporter was Geraldo Rivera. The children making that sound were residents of the Willowbrook State School, and what had been done to them for 15 years in a separate ward with the signed permission of their parents has one official explanation. That explanation uses a single word. The word is prevention. I want to show you the letter that word came from. It was sent to parents of newly admitted children sometime between 1956 and 1970. It was preserved and published in David Rothman and Sheila Rothman's 1984 book, The Willowbrook Wars, on pages 265 and 266. The letter begins, "Dear Mrs. We are studying the possibility of preventing epidemics of hepatitis on a new principle. Virus is introduced and gamma globulin given later to some, so that either no attack or only a mild attack of hepatitis is expected to follow." That letter was a consent form. Parents signed it. The letter does not say that their child will be given hepatitis. It says that a virus will be introduced. It does not say who will introduce it, or how, or that the introduction is deliberate, or that their child, at that moment healthy, will be made sick on a scheduled date in a controlled room by a research team from New York University. What exactly was being prevented, and for whom, is the question the letter does not answer. To understand why that question matters, you need one number. Willowbrook State School was built for 4,000 residents. By 1965, it held 6,000. By 1969, the population had reached 6,200, 55% above designed capacity. At that population, there was approximately one attendant for every 50 children. 60% of residents were not toilet trained. The conditions produced, predictably, endemic disease. Dr. Sol Krugman of New York University was brought to Willowbrook in 1955, officially to study and control infectious disease. His own surveys produced the following finding. A child admitted to Willowbrook had a 1 in 2 chance of contracting hepatitis in their first year. By 1972, that number had reached 100% within 6 months of admission. The official conclusion drawn from this data was not that the institution was a public health emergency. The official conclusion was that it was a research opportunity. From 1956 to 1971, 15 years, Dr. Krugman and his team ran controlled hepatitis trials on newly admitted children. The children who participated were housed in a separate unit, newer, cleaner, with round-the-clock monitoring. The rest of Willowbrook's 6,000 residents remained in the wards. In 1964, Willowbrook closed its main intake to new admissions. Overcrowding had made it impossible to accept more children. One unit remained open, the Hepatitis Research Unit. Parents who wanted their child admitted to Willowbrook, and in 1964 There were few alternatives for children with intellectual disabilities in New York State. We're told that space was available in one part of the facility. That part required their signature on a consent form. Who decided which children were admitted through that door and who was turned away is a question the official record does not answer. But the experiments themselves left a timeline, and that timeline has an exact last moment. The hepatitis experiments at Willowbrook ran from 1956 to 1971. Their results were published in the New England Journal of Medicine, The Lancet, and the Journal of the American Medical Association. In 1958, the New England Journal of Medicine published a paper describing the results of feeding infectious fecal extracts to 51 children. A year later, a second paper described the inoculation of infectious serum into 9 children. Neither paper prompted a published objection in the United States at the time of publication. On January 1, 1972, Willowbrook State School stopped accepting new admissions entirely. The isolation unit used for the hepatitis studies was formally closed. No public statement was issued. No explanation was provided for the timing. No record appears in publicly available archives of any internal review, any disciplinary action, or any notification to the families of children who had participated in the studies over the prior 15 years. 6 days later, on January 6, 1972, Geraldo Rivera's footage aired on WABC-TV. The footage showed children lying unclothed on ward floors, children with no attendants, a ward that, by Rivera's description, smelled of filth, disease, and death. The Hepatitis Research Unit, the clean ward with round-the-clock monitoring, does not appear in the footage. It had already been closed. Between the day the unit closed and the day the footage aired, there are 6 days. What happened inside the institution during those 6 days is not in the public record. There were, at that point, 2 physicians still employed at Willowbrook who had been trying to make what they knew public for over a year. Dr. Michael Wilkins was a staff physician at Willowbrook State School. He was fired by the administration after he began organizing parents to demand improvements to conditions, not to the research unit, but to the general wards where the majority of residents lived. After his termination, Dr. Wilkins contacted Geraldo Rivera. He provided Rivera with a stolen key to Building 6. He helped Rivera cross the perimeter fence. He then appeared on camera in Rivera's broadcast and stated the following: that 100% of residents at Willowbrook contracted hepatitis within 6 months of admission. Dr. Wilkins did not, in that broadcast, discuss the research unit specifically. He was describing the general population. The number he gave, 100%, was the same number researchers had been documenting and publishing in peer-reviewed journals for over a decade, while simultaneously using it to justify continued experimentation. Dr. William Bronston was the other physician. He worked at Willowbrook from 1970 to 1972 and was dismissed after, in his own words, he had done everything he could from inside the institution to raise awareness of conditions to no avail. Bronston became a star witness in the 1972 class action lawsuit, New York ARC versus Rockefeller. His personal collection, evidence he assembled for court, photographs, legal documents, case histories, is now held at the M. E. Grenander Department of Special Collections and Archives at the State University of New York at Albany. Both men lost their jobs at Willowbrook before the footage aired. Both were replaced by staff who did not speak publicly. What the remaining staff knew and did not say is not recorded in any document available to the public. And then there is a coincidence that the official timeline treats as unrelated. Consider what else was happening in 1972. In January 1972, the hepatitis unit at Willowbrook was closed. In January 1972, Geraldo Rivera's expose aired. In March 1972, a class-action lawsuit was filed on behalf of 5,000 residents. The parents had organized. The lawsuit alleged constitutional violations, indefinite confinement, overcrowding, inadequate medical care. The lawsuit did not specifically name the hepatitis experiments as a constitutional violation. It addressed general conditions of confinement. The experiments had ended. The papers had been published. The research was, in the language of the official record, complete. Now consider what happened to Dr. Saul Krugman after 1972. Krugman remained an active and celebrated figure in American virology through the late 1970s and 1980s. His research at Willowbrook contributed directly to the identification of hepatitis A and hepatitis B as distinct viruses, a discovery of genuine scientific significance that led eventually to the hepatitis B vaccine now used worldwide. In 1986, Krugman published a retrospective defense of the Willowbrook studies in the Oxford Journal Reviews of Infectious Diseases. He wrote that the ethics of informed consent had shifted since the trials began, but maintained that the studies had reduced infection at Willowbrook and posed minimal additional risk to participants. His subjects in that paper remain unnamed. They appear as data points. The World Medical Association had adopted its International Code of Medical Ethics in 1949, 7 years before the Willowbrook experiments began. That code stated that under no circumstances is a doctor permitted to do what was subsequently documented in those 1958 and 1959 papers. The 1973 New England Journal of Medicine editorial that noted this fact also noted that when those papers were first published in 1958 and 1959, no objections had been raised. The parents who signed the consent letter did not know the code existed. Most of them did not know their children were research subjects in a sense that the code explicitly prohibited. Those parents never knew what files existed in their children's names. Some of those files, to this day, no one can read. The New York State Office of Mental Retardation and Developmental Disabilities holds a collection titled Willowbrook Litigation Support Files, 1972 to 1986. It is held at the New York State Archives in Albany under call number 21414. The finding aid describes the collection as documenting the litigation over conditions at Willowbrook, the agency's response to the litigation, and oversight of class members during and after the litigation. The records are currently restricted. The Willowbrook Review Panel records 117 cubic feet of documentation from the Federal Monitoring Group established by U.S. District Court in 1975 are held at SUNY Albany. The panel monitored implementation of the 1975 consent decree until it was dismissed from its duties in 1987, the same year Willowbrook closed. The individual names of children who participated in the hepatitis studies between 1956 and 1971 do not appear in any publicly accessible database, index, or memorial. The studies were published with patient designations, initials, case numbers, subject codes. The consent letters were addressed, "Dear Mrs. City Schwab." The children do not have a wall, they do not have a monument, they have footnotes, but some of them have names, and some of those names still speak Bernard Carabello was 3 years old when he was admitted to Willowbrook State School. He has cerebral palsy. He was misdiagnosed. He remained at Willowbrook until he was 21 years old, when he left of his own choice. He was interviewed by Geraldo Rivera in 1972 while still a resident. He is today the founder of the Self-Advocacy Association of New York State. Judy Moisef also has cerebral palsy. She lived at Willowbrook for nearly a decade. She today runs a company called Judy Speaks, focused on disability awareness. She has testified publicly about the emotional consequences of her time.